Hi, my name is Zoe Roberts. I'm a County Board Supervisor for Eau Claire County. There are three words in the English language that would promote equality, fight poverty, and help more Americans than any other bill in the last 50 years. Those words are Medicare for All. Medicare for All would promote equality by leveling the healthcare playing field. No longer would only the rich, and those slaving away for rich corporations, be able to get the healthcare they need and deserve. It wouldn't matter if someone was black, brown, indigenous, newcomer, or rich or poor. Everyone would have access to quality health care, and no one would ever be denied treatment because they aren't insured. For folks living in poverty, Medicare for All would give them a better chance of getting out of it. Imagine living in a country where you can go to the doctor and not go bankrupt for doing it. I've read so many articles about people being forced to ration their medications or skip their doctor's appointments because they can't afford it, and many of these people even die. Imagine the lives we could save with these three simple words: Medicare for All. What many of you may not realize is that I spent 12 years of my professional career in the private sector for one of our nation's largest insurance companies, specifically working in the Medicare and retirement field. I've seen how damaging not qualifying can be. I know firsthand. When it comes to Medicare, as Arnold Schwarzenegger once said in Terminator 2, I have detailed files. To all of those naysayers that want to keep their employer group coverage, I have a simple solution for you. Turn your employer group plan into a Medicare Part C plan. This is what you see advertised as a Medicare Advantage plan on TV. In this day and age of COVID-19, with so many working class folks furloughed and laid off, Medicare for All would allow them to revert back to original Medicare so they'd still be insured and have the ability to get the care that they need, whether it be to recover from COVID-19 or something else. This would have prevented in excess of 40 million working class Americans from losing their health care coverage during a global pandemic. Additionally, Medicare for All would give CMS, the Centers for Medicare and Medicaid Services, the ability to negotiate prices with hospitals, clinics, and doctors across the board. This would drive down health care costs for everyone in America. What most folks don't realize is that Medicare is an extremely efficient and well-run program. Administrative costs for Medicare are roughly 2% compared to, in some cases, upwards of 18% for non-Medicare commercial plans. According to PolitiFact, this would annually save the American people roughly $383 billion on administrative costs alone. This is why I support Medicare for All, and this is why I hope all of you support what would be the biggest advance in American society in the last 50 years. Thank you. Running resolutions through city and county government starts building a foundation of a movement so that we can push for greater healthcare coverage and build that foundation brick by brick. Well, I think it's a choice of whether or not we cover everybody and we give everybody a fair shake at healthcare, or we continue to let people die in waiting rooms because they don't have healthcare insurance. Well, I think it's a little bit different for city council versus county board. County board, we start the process with corporate council, and then the resolutions are going to get assigned to a committee. And once they go through a committee, that it's going to be the committee that is the most appropriate for that resolution. So Judiciary and Law, which is what I'm on, really wouldn't have much to do with this one, but you might be looking at like a health services kind of committee that would have a lot to do with it. So it's going to be assigned to that, and then they're going to take and review it, potentially modify the language, and either approve it or deny it at the committee level. If it makes it through the committee level with the county, then it will go before the full board and be voted on. It's a long process. It takes time to pass resolutions. They don't happen overnight, and they are a lot of work, but there's so much work that the public doesn't see. It's a matter of staying on something and being consistent and driving toward your end goal. It may take many months to do it. It may take in some cases a month to do it. Other cases it might take 2 or 3 years to do it. But it's a matter of sticking with it. So in local government, to make passing resolutions easier, there's something that everybody can be. They can be involved. So we start talking about what we're talking about here is a co-governance model. A co-governance model is going to inspire activists to come out and support us, while we also are supporting them. It's a two-way street. But when all too often what happens is that activists and folks come to us and they ask us to pass something, and then they disappear into the background and they don't push for it. That push has to come from the public. Without that public support, a lot of resolutions die. People can get involved and help move things forward by writing their congressmen, writing their state senators, writing their state assembly people. You can send postcards. You can be involved in, grassroots organizing groups. You can do so many things and have a lot of fun doing it at the same time. Yes, it absolutely makes a difference when people are involved and people are pushing for a cause. We saw that with the windmills that were slated to go south of town. We saw that with a number of different things. When the public is passionate about something and they're pushing for it, it makes a world of difference.